Hi, my name is Emma O'Connor. I'm the reproductive policy reporter with BuzzFeed News. I'm here with Dr. Leana Wen, the new president of Planned Parenthood who just started in the fall. Hi, Leana, how are you doing?
I'm well. Thank you for having me here, and I'm glad to be able to come to provide clarification to an article that you published this morning, and specifically the clarification that the fight for reproductive health and rights is truly the fight of our time. With the Supreme Court, we're facing a situation where 25 million women, which is 1 in 3 women of reproductive age in this country, could be living in states where abortion is banned, outlawed, and criminalized. This is about patients' lives, and Planned Parenthood for over 100 years has fought to protect access to reproductive health care, including the right to safe legal abortions. We will not back down. We will do everything we can to fight in the courts, to fight by electing pro-reproductive health, pro-women's health champions. That's what we're committed to. We are here to provide care no matter what.
Great. Yeah, actually, that leads into my first question really well, which is Planned Parenthood has been a flashpoint politically for the past 8 years. So how will you be able to kind of move away from that and address that further, if you could go into a little more detail?
Well, healthcare shouldn't be political. Getting medications for your children, vaccinations, getting STI checks, breast and cervical cancer screenings, that's healthcare. I know that as a doctor. This is about people's lives that's at stake when we restrict people's access to healthcare. But unfortunately, healthcare has become political because there are so many people who are restricting access to care. In the last 7 years, there have been over 400 laws passed that directly restrict abortion access. And I know what's at stake. It's about women's lives. And that's why, for me, it's about 2 things. It's about first providing care and doing everything we can to provide services to people where they are. But we just as much have to fight to protect access to that care. Those 2 parts go hand in hand, because really we need to be standing up for how reproductive health care, including abortions, is part of the full spectrum of healthcare. And healthcare is a human right.
So you just became president of Planned Parenthood in the fall, in mid-November. How will your leadership differ from your predecessor, Cecile Richards?
It's not different, because Planned Parenthood for over 100 years has been about providing health care and equally fighting back with everything we have to protect access to that care. Abortion is a standard medical procedure. It's something that 1 in 4 women in the U.S. will have in our lifetimes. And yet, what other medical procedure is restricted in the same way that abortion is? What other medical procedure have there been hundreds of laws passed that there are daily attacks to prevent people from accessing what's standard medical care? So I'm here to say the same thing that my predecessors and all of us here at Planned Parenthood have said, have fought for, which is that reproductive health care is health care, women's health care is health care, and we have to double down and fight with everything we have because it's about people's lives.
Yeah, so before this job, you were Baltimore Health Commissioner since 2015. You did a lot of really groundbreaking work with them. How does your experience there help contribute to this new role and help contribute to the fight?
When I was the health commissioner in Baltimore, we achieved some record successes in public health, including reducing infant mortality in our city by almost 40%, cutting the disparity between black and white infant mortality by over 50%, reducing the teen birth rates by 61%. And yet, the Trump administration cut our teen pregnancy prevention program, just as it was cut around the country. So we in Baltimore sued the Trump administration, and we won, restoring funding to 10,000 of our youth so that they can get comprehensive sex education. It's that same spirit of providing care, but then recognizing that we would not be doing everything we can unless we fought to protect access to that care, and that we're fighting for science, we're fighting for what is right, that I'll be doing in this role too. And similarly, we are doubling down now on fighting to protect Title X, which is the national program to afford to provide affordable birth control to low-income women and families. Any day now, we expect that the Trump administration will be cutting this program and preventing 4 million people from having access to reproductive health. We'll be fighting against this. We'll be fighting against so many of these other horrible restrictions that are coming out on a daily basis.
Yeah, so related to that, you have a friendly Congress now, or at least in the House. It's majority Democrats. There's a lot of new members who are very pro-Planned Parenthood, and that was part of their campaigns. And I know you mentioned to me that you've spoken with a lot of them about kind of fighting going forward and working together. However, in the past, a lot of abortion funding and funding for Planned Parenthood specifically has held up legislation because of Republican opposition. And as you just mentioned, Trump is also on that side. So do you still feel concerned that there's a threat to defund Planned Parenthood and defund abortion care in general?
Well, I first want to say that I'm so happy to be working with these newly elected champions, these strong pro-reproductive health, pro-women's health champions in the House of Representatives who are a wall against defunding efforts. They are a firewall to protect Planned Parenthood, to protect the millions of people that we serve every year. I mean, I was a patient of Planned Parenthood. My mother and my sister were patients of Planned Parenthood. So have 1 in 5 women in America been patients of Planned Parenthood. This is really about people's lives, and I'm thrilled to be working with our champions. And I think that also illustrates why it's so important for us to be electing individuals as our leaders who protect choice, who protect access, who protect the fundamental right to health care. Mm-hmm. And that's why we'll be fighting back in every way. We will be looking to 2020 to elect even more champions and working on the state level as well, which is so critical. Mm-hmm. In this last cycle, we have elected now 25 pro-reproductive health governors, 19 legislatures, including D.C., that are pro-reproductive health, pro-women's health. And we'll be looking to the states, too, because the states are a critical backstop that will allow us to repeal these terrible laws that restrict abortion access and allow us to push back and expand access and expand health care and expand the fundamental right to safe legal abortions and the full spectrum of reproductive health care.
So do you think that the funding fight is still one that is a concern, or do you think it's kind of moving on to the other concerns that you mentioned, that those ones, because of the way that Congress is now, have taken kind of more priority for Republicans?
Well, look, Planned Parenthood and more generally abortion access and reproductive health care are under attack every single day. Mm-hmm. We see restrictions being passed that are so onerous and so horrific that it's almost difficult to talk about. I mean, Iowa passed a ban on abortions at 6 weeks when most women don't even know that they're pregnant. I mean, these types of things are happening all the time in states around the country. And that's why we need to be fighting on every level. We need to be fighting in the courts. We need to be fighting in the states to both repeal these restrictions as well as protect and expand abortion and reproductive health access. And we have to be fighting in Congress. We have to be working with our new champions as well as working with our longtime allies in order to fight against this Trump-Pence administration and all these horrific restrictions that are coming out too. I mean, less than 24 hours after the American people rose up and elected a pro-reproductive health majority in the House of Representatives, the Trump administration passed a rule that, or finalized their rule, that would allow employers to deny women birth control coverage. I mean, what year is this and we're still debating birth control? Title X restrictions coming out any day, denying 4 million people affordable birth control. That's what's at stake, and that's why Planned Parenthood's role will be to expand our influence, expand our impact, expand our care, expand our advocacy, expand our political power, because we have to. It's about patients' lives.
So you're about to go on a clinic tour of, I think you said 20 clinics in 5 months around the country, Planned Parenthood clinics. That's connected to your the This Is Healthcare campaign? Is that correct?
Tomorrow,
yes.
I'm about to launch a national listening tour to our 20 affiliates. We have 55 affiliates around the country that provide care, and I'll be visiting 20 of our affiliates. We have over 600 health centers, and I'll be doing that over the next 5 months. And I'll be highlighting the work that our affiliates do around the country to center on sexual and reproductive health care and to provide for the whole woman, for the whole person. Because that's what we're all about. We know that the patients who come to us don't just have one need. That reproductive health care is part of the many issues that they may be coming with us to. So we are, across the country, our 600 health centers are proud to provide services like STI screenings, cancer screenings, HIV linkage to care, well women exams, trans care, and so many other services. And I'm excited to visit with our affiliates, learn more about their innovative work, and how being pro-women, pro-reproductive health care is being pro-family and being pro-community. Mm-hmm. And many of our health centers, many of our affiliates deliver care in extremely challenging political environments. And I'm excited to look to see how they thrive and also how our advocates on the ground fight back in their states against these onerous restrictions, mm-hmm. and still provide care no matter what.
So you mentioned that among the other services, you're looking to potentially expand mental health care and opioid addiction treatment in Planned Parenthood affiliates around the country. Could you talk a little bit more about that?
We know that there is huge unmet need when it comes to healthcare. When we did a survey of our patients, we found that the #1 unmet need that they identified is mental health. This is something that we across the country just do a terrible job of, when in fact mental health is just as important as physical health. And so we'll be looking to expand all of our services, expanding abortion access, because that's also a huge unmet need, expanding sexual and reproductive health, our core services. But we're also looking at expansion of care overall, because we know that there's huge unmet need. I mean, we look at maternal mortality as an indicator. We know that the rate of maternal mortality, the rate of women dying in childbirth, is higher today than it was in 1990 in the U.S. An African-American woman is almost 4 times more likely to die in childbirth than a white woman, 40% more likely to die from breast cancer than white women. There's huge unmet need, and Planned Parenthood has always been about stepping up to meet these needs in communities, to provide the care, because for so many of our patients, we are their only source of health care. And it's our obligation to provide care to everyone, while at the same time fighting with everything we have, because we can't literally provide the care if there are laws that prevent us from doing so. And we as a country need to step up and recognize that health care is a human right that must be guaranteed to all. And abortion and reproductive health care are part of that full spectrum of health care. It cannot be a privilege that only the wealthy, the privileged are able to get to. Health care must be a right for all.
Well, thank you so much for joining us, Dr. Wen, and we have more AM to DM up next.